Stakeholders that are here. My name is Honorable Dr. Midala Usman Balami. I represent Askira-Uba, Hawul Federal Constituency from Borno State. Mr. Chairman, I think, thank you. The Permanent Secretary, thank you for this elaborate that you've just brought on board. I think it is key for us to have this conversation, and it is coming timely because at the beginning of this particular administration, there is need for us to look inward and begin to tell ourselves some facts, some truth, even some bitter truth that we need to have confronted long ago. For me, the need for us to declare emergency in the health sector has been long overdue. Many have talked about different things, but I will want to restrict myself to the component of human capacity, welfare, and resource management. The Permanent Secretary, you've quickly, at the end of your message, pinpointed how we have best brains in Nigeria. However, I think these best brains are not effectively utilized. You will agree with me that if you go to different rural areas, you find out that you hardly have skilled health workers. This is simply because the packages, the payment, the welfare of these health workers are not well put in commensurate with what other developing or developed countries are doing. Yes, of course, I have worked with the United Nations for 8 years, specifically United Nations, UNFPA, as sexual reproductive health specialist. We have worked seriously in Borno State where we established a lot of facilities, including Fistula Center, the biggest Fistula Center in the Northeast. In 4 years, we have repaired 648 VVF survivors. Today, they have been integrated into their different communities. This was so because the packages and what was entitled for us were well placed. You will agree with me that in some of the villages, if you go to my place in Hawul, some of the general hospitals, the PHCs, you hardly even have a single doctor. Hawul is one of the most advanced LGA. Go to Askira-Uba, the same thing. When we talk about healthcare services and we narrow it around big towns like Abuja, Kano, Lagos, and all of that, what are we talking about? The people in the rural villages. Of course, in Borno State, we have gone to a stage of even begin to push for tax shifting, tax sharing policy for us to adopt health workers, to take responsibility of nurses, simply because those nurses that we produce in Borno State have to flee or be taken over by donors agencies. What is our country doing? Why should we allow donors agencies come to our country, pay better than us, and take them and give them the direction of what to do? I think Nigeria should be very sincere to itself, go to the drawing board, look at the package, put it on a concrete ground and ensure this is working. We cannot continue to pay lip service to healthcare and believe that we can grow as a country. A healthy community is a productive community. We cannot, and this is key for Nigeria to be able to grow. We must be intentional. We must be direct and we must have focus and remain consistent in doing this. While the health institutions are training health workers, they already knew they have work to do to protect the health of our people. I'm just opportune because in Borno State we are able to have a lot of hands helping us. This is simply because of the crisis. What of areas that have not had any crisis? Are they having the same support? No. Why should we wait until crises come before our people can benefit for something as basic as health? If you are no longer alive, what importance are you again? Please, my brothers, in this place, let's come with a unified voice. The voice is that go to the drawing board. The health is the most critical component of this country. This country is standing because we are healthy, and every component of the health, human resource, welfare packages, and distribution of health workers to communities In fact, I want to say that somebody that is being sent to a remote community should have higher package to attract them and be able to do their job. We must have something to be able to do that. Thank you. God bless us all.